All right, welcome back to another episode of the Primal Performance Podcast. This is your host, Chad Sheen, with my lovely co-host, Melissa Leach. We have a special one for you guys today. Another guest. His name is Dr. Tim Whiting. Dr. Whiting is a doctor of chiropractic medicine and a clinical educator. He's actually one of the main reasons I stayed on campus in New York to get mentored by him. He has more accreditations and certifications that I can count. And I think he's going to have a lot of insights and information to share with you guys, and I'm looking forward to it. So without further ado, Dr. Whiting, welcome.
Hi guys, thank you for having me on. I really appreciate you giving me this opportunity.
Absolutely. Doc, just to start, if you don't mind, just kind of giving us a rundown, introduce yourself and tell everyone what you do.
Yeah, so again, my name is Dr. Tim Whiting. I am a chiropractor and a chiropractic educator. I began this journey, many years ago in high school, trying to figure out what I wanted to do in my life. Always was kind of infatuated by medicine, and so that was just a broad category. And as I kind of worked through and figured stuff out, I really wanted to do something where I can incorporate that, but still work with my hands, because as growing up, that's what I was always doing. So at first I was looking at physical therapy, shadowed some of that for a while. Some things just didn't really click with that for me. It wasn't a huge fit. Went to undergrad, pursued, health sciences degree, bachelor's, major bio, minor chem. Throughout that journey, ended up actually hurting myself, hurting my back, lifting injury. Went to a chiropractor when I was in undergrad, and he just completely opened my eyes to chiropractic as a possibility. For whatever reason, it was not on my radar. His passion, his enthusiasm for the profession, the respect of his patients, I was just in awe. So jumped right in, decided that's what I wanted to do. Once I graduated from Lemoyne College in Syracuse with my undergrad, went to New York Chiropractic, which is now Northeast, got my chiropractic degree there. After that, graduated, worked in Syracuse, New York for 2 years, 2.5 years with another provider. Started part-time at the college just to make some extra money at the time, and then actually like really fell in love with the education side of chiropractic. So I love treating patients, but I found this new passion where I really just loved seeing young clinicians' minds grow and watch them go from the classroom to the clinic and really put it all together. That just really excited me, and I love kind of seeing that transition. And so a full-time position opened up there. I applied, got that, and that's what I had done for the last 8 or 9 years now, until I just recently left. And now I'm doing the same thing, chiropractic education at the University of Bridgeport instead. But yeah, so I really just fell in love with that. But I still get to do the hands-on stuff with patients, which is huge for me. I didn't want to just do all classroom. So I still do some classroom teaching, still treat patients, but then I'm really hands-on with the students in their clinical setting with the patient care. That's really just what I found my passion doing.
What do you notice that's the big difference between treating patients in the private sector versus in a clinical setting? What have you found to be the pros and cons and maybe the struggles in both?
Yeah, so I would say in the education aspect of it, there's just a lot more things to juggle. So a lot of your time is spent behind the scenes worrying about things with the students and logistics and grading and analyzing things. So you get sidetracked a little bit more and you can't focus your whole attention on patient care. So it makes you, nervous you're going to miss something. So you got to slow it down. So that's one component of it. Um, Outside of that, um, I would say just different patient populations, people that are willing to come in and see students is tough. So not everyone wants to see that. They're worried about the experience and their ability to get good care or not. So that's something that you see. So you might have a little bit of limited patient exposure or different types of patients in that setting. But outside of that, it really runs as normal. You still see patients with, same problems. They, have money issues. They worry about their insurance. So you still get to see all of that. Some of the pros also of working at an institution, when you get out and you start working, you really learn that benefits are a major factor. So things like health insurance or retirement, 401k, things like that really come into play. when you're trying to start your life up and realize that as a young professional. So a bigger college and institution can offer some of those things a little bit more that maybe in private practice you have to come up with on your own. As far as private practice goes, I mean, ultimately, you're going to get the autonomy to do whatever you want. If you open up your own practice, I mean, the sky's the limit. You're capped at a college level or a school level. I can only do so much, make so much money, see so many patients. Private practice, you could open up 16 clinics if you wanted to, never work a day in your life and make millions of dollars. You could work a small practice seeing 40 patients a week for the rest of your life and be happy. It's just limitless. I mean, you can do whatever you want. So I think the total upside of private practice, owning your own, is definitely way higher. It's not even comparable. So that's something that you miss being in education versus a private practice situation.
Awesome.
What would be our podcast kind of goes after general population as well as clinicians. What's something you would want the general population to know about chiropractic medicine that they might not know currently?
Yeah, I think when I was looking at this, I came up with a few things. I think one is that they don't just treat back pain. They don't just treat the back, the neck, right? Everyone thinks of us as spine, which is a major focus. But we really are neuromusculoskeletal specialists. So you've got a rotator cuff issue. Some of the best docs you're going to see are chiropractors, a sprained ankle. Then you've got even some other conditions that are neurological conditions, right? So just think of them as more neuromusculoskeletal docs. They really know the body, not just the neck and the back. And so it will open up what you can go see them for. That's probably one of the biggest things. And also, don't underutilize them. Remember that they're also a good referral source for other things. Even if they can't do something for you, they're great what we call portal of entry docs right now, where you go to them, you're not sure where to go, and they can help you through the process with a referral, a written referral, a phone call to another provider, which is super important in medicine these days. Is how do I get in with this neurologist, this specialist? How do I take the next step to get this test? And a lot of times we just don't have that relationship with our primary care doctors anymore. And so chiropractors are kind of filling that void where, hey, let me help you get to this doctor, this other provider, get this special test that you need. I can help accelerate that process. So I think that's something that you can take advantage of as a patient of chiropractic.
Awesome. Yeah, something that you and I both see for me as a student and for you as a clinician for many years now, we see back pain, neck pain so much every single day. What tools would you provide people in the general public for dealing with these tools, both in the clinic and outside at home and in the gym?
Yeah, it's so hard to wrap things down to a couple things, but I mean overall, when I'm looking at back and neck pain, I think ergonomics is a big issue. Most people spend a lot of their time sitting at a desk. That's most people's work in some capacity. So really paying attention to your station setup, the height of your screen, how everything is within your reach, how you feel, making sure you've got good support for your back. So I know it's a broad category, but ergonomics for a desk is huge. Something so simple that can cause a lot. I mean, think about anyone sitting at a computer, that's going to cause neck pain, stress, they're looking down, or even if their chair doesn't have good support. Again, there goes your low back. So having a good setup, ergonomics for your computer, having something, if your audience looks up a lumbar roll or a lumbar half roll, you'll see, find them on Amazon for pretty cheap. Something you can tuck behind the small of your back when driving, when sitting at your desk, just to give you that extra support. That was something I found to be wildly helpful. As a chiropractor, I had started having an hour commute each way to work, and all of a sudden was having horrible back pain, disc symptoms, and it was just because my car was just not supportive. I tucked a lumbar roll under me, and everything like cleared up on its own. So really thinking posture ergonomics is something important, and then just general fitness, general wellness. Losing 5 to 10 pounds, you'll be surprised on how much better you will feel. Your joints will thank you, your heart health will thank you, your energy will thank you. So keep that weight in check. It doesn't have to be much. You'll see how big of a change that is. And then really pay attention to your posture and ergonomics.
One of the actually reasons I was there were lots of reasons why I was interested in having you on the podcast, but I train yoga teachers and work with a lot of people who walk in with back pain and neck pain, and they get referred into a yoga class. So I have an opinion here, but what are your thoughts on some of the like extreme back bends and deep spinal rotations that are taught traditionally in yoga, and how does that mesh with people telling, whether it's physical therapists, chiropractors, kind of this blanket statement like go to yoga for back pain and it'll help your back pain and stretch it out?
Yeah, I mean, without a diagnosis, just say go do this for this, it's very hard. There are some patients that I would never send to yoga for certain reasons. So yeah, it's definitely hard when you send anybody to one therapy or yoga or working out. It'd be like saying, hey, go to the gym and lift weights with no guidance on how to do that, what things to avoid, maybe what things to do. So I'd say biggest thing would be finding somebody in the area that you trust. If I'm a chiropractor and I'm sending somebody to for yoga, I'm gonna want to know something about them. Maybe meet with them in person and say, "Hey, I'm thinking general fitness and stuff is great for patients, especially with back pain. If I send patients here that have back pain, is there going to be eyes on them to make sure that they're doing poses correctly, that they make sure they're working with inside of their limitations? Or if they say, hey, this doesn't feel good, do we stop that? That was a big issue I saw with CrossFit at first. It was like, everybody go do CrossFit. It's so great, which not saying it's not, but when it's unregulated, unguided, you have poor coaches that are just in it for the volume. It's completely different versus you go to a good box that trains you properly, says, no, you're not to this level. You can't do this yet. So I would say it's not a blanket, no, don't go to yoga because you have back pain. It's also not blanket, yes. It doesn't make sense for you as a patient. And is there somebody in the community that I trust that if I send them there, they're going to get the guidance that they need to make sure they're not doing stuff that is actually going to hurt them in the long run. And then checking back with them as my patient. Did you go? How did you like it? What did you not like? What moves didn't seem to feel comfortable for you? Hey, maybe next week we don't do that one. But again, that means they talk with the trainer that is there. So that would kind of be my answer to that. Build a relationship, make sure they're going to someplace good that's got good oversight and someone that's not just going to throw a blanket program at them, and work in the community together to make sure that, hey, they can do yoga or they can do this thing with back pain and still get benefit from it.
So speaking to that process of diagnosis and treatment, how did you navigate learning the systems that you have in place for the diagnosis and treatment, and just communication with patients as a whole, as a new graduated doc moving into the field?
Yeah, learn diagnosis is tough. I mean, do as much as you can in school. I've taken some of what I've learned and put it into school, as you've seen, to kind of help navigate and give you some framework, but it's not done. Even when you have that framework, it still takes exposure. There's no lie that your first 5 years in practices, you're just going to be learning so much. It's impossible not to. You just haven't seen the volume of cases yet. You haven't seen an array of types of cases yet. So you just have to get that exposure. It's just like any job. You don't know how to navigate things until you've seen it many times over. And it just starts to come naturally, as kind of cheesy as it sounds, but it is, until you've seen 60 disc pain patients. All of a sudden now 61, you're like, oh, I got these. These are easy. But before you didn't, they were tough. So exposure is huge. You're just going to continue to learn your first couple of years in practice. And then just not being afraid to look things up when you don't know them. And you don't know everything. To this day, I don't. And if I don't, I'm going to go back to the drawing board. I'm going to go to textbook. I'm going to go online videos. I'm going to look up research articles. I'm going to call a buddy, talk to somebody that's been in practice for years longer and just find an answer, because I can't know everything. So just that thirst for knowledge and answers needs to be there. It can't stop when you're in practice. That's how you miss things, when you fall into the norm. It's like, oh, I got this, I know everything. No, you've always got to be, up in your game. So I think continuing education for sure, looking things up when you don't know them, and exposure are the best things to start with the diagnosis part. With that, you're more knowledgeable. So now it's easier for you to relay that back to your patient. And again, as you know, as being one of my students, patient education is huge to me. If patients don't understand their condition, the words you're using, what's going on with them, how you're treating them, we're missing a puzzle piece. The patient knowledge and education part is huge. So one, it puts their mind at rest to know that, hey, maybe this isn't a debilitating condition or it's not as scary as I once thought it was. But it also gives patient buy-in to where I'm like, okay, you explained this well. I understand. We're on the same page. We're doing this together as a team versus I'm your doctor and I'm telling you what to do, right? That is always going to create animosity. So once you're educated, you relay that information back to your patient. You make sure they're educated on everything that's going on. You make them part of the decision. Again, at the end of the day, it's their body. Like, do you want to do this? Are you on board with this? Do you have questions for me? So that's huge. And part of that for me also came from years of hospitality work before. I worked in restaurant industry for many years. And so just that being able to talk to anybody at any time, you need to be a good communicator. And I think going into chiropractic, most people are outgoing, and as you get more exposure to more patients, that'll come easier. But I always emphasize that too. Just remember, we are also hospitality. You have to be able to talk to people, and people need to be able to open up to you. So making sure that you can just clearly and openly communicate with your patients, they'll kind of open up to you on their own, and it'll make that conversation happen easier.
So speaking to the patient communications, that's something that I've noticed myself and others in my position struggling with, how to have the conversation with the patient and relay information. We understand the lingo different than they do. How do you see that being a big learning curve for students? And what would be some of your advice for students, whether they're going into medicine as an MD, a physio, a physical therapist, or a chiro?
Yeah, I mean, that's definitely a learning curve. We just spent, in your case, I'm going to talk about clinical students because that's what my exposure is. We just spent the previous 3 years jamming down all this medical language to you, testing you on it frontwards and backwards and conditions and all of this. And now we expect you in the room to switch it off and say, oh, you can't talk like that anymore because you have to explain it to your patient. And that's a learning curve. It is. It has to be like, yeah, I know you know those words now. I know you know those diagnoses, but we got to remember the patient hasn't had 3 years of medical school. We've got to turn it. I hate using the word dumb it down, but simplify it for the patient. Remember what it was like before you were in school. You didn't know what that word meant either. So it is a learning curve. It does take time. You see it on your patients' faces when you're explaining stuff. It's a blank slate. Like, okay, I'm talking over them, over their head right now. I need to get on their level. And that's what I try to tell students. It's just like, simplify it for them. Don't make it complicated. Ask them if they have questions, if they don't understand, reword it. But it just takes that time of also paying attention to the nonverbal cues of, does your patient look like they're understanding? Are they nodded blankly? Are they confused? And with that communication, I always say you need to talk and you need to listen to understand, not listen to. There's my dog. Said listen to understand, not listen to respond, which is a big thing. Is like, I'm listening to you so I can write down something on my piece of paper in front of me versus I'm listening because I truly want to understand what's going on with you and your story. That's another learning curve. And there's seasoned doctors that are like that too, that are very like checkbox, like, I got to get out of here. I got 6 more patients. Tell me what I need to know versus putting down that piece of paper, actually listening to your patient, understanding them, and getting on their level. I think that's a huge thing that we need to learn. Many, when you're in school, but even afterwards for other professionals too, is that good bedside manner of good communication.
Speaking of that, what do you see or what do you want to see more of within the chiropractic profession? What do you find that's missing in a lot of both clinical offices, but also school curriculums that, the start and the base of the chiropractic industry as a whole?
Yeah, I think interprofessional collaboration is something huge. You learn about it in school, and we try to teach it to you, but it's hard when you're not the ones in control as a student. The doctor's still kind of in control and handling a lot of that stuff behind the scenes. But that's huge when you go out into practice. It's going to help the profession as a whole too, because it's going to get buy-in from other professions to see like, oh wow, this chiropractor knows what they're talking about. They made the right referral to the right provider. They ordered the right test. They caught this condition that I know other doctors have missed or haven't caught yet. So being able to collaborate and communicate with other professionals, whether they're medical doctors, whether it's an orthopedist, a neurologist, a physical therapist, a speech therapist, a nurse, whoever it is, being able to communicate with them, whether that's via traditional letters that we do, whether that's picking up the phone and calling them. So I think interprofessional collaboration is huge because it's going to expose other providers to what we can do and our skill set and our ability. But that also starts with the chiropractor being able to diagnose properly, giving patients a proper diagnosis of, hey, it's not your spine is rotated and I'm going to unrotate it for you and fix you. Great, that's an easy analogy to explain an adjustment to somebody, but at the end of the day, that's really not what we're doing. So being able to properly diagnose our patients and offer them the right care without getting caught up in these kind of cheesy, old school thought processes that have kind of drug our name through the mud for many years. So proper diagnosis first, and with that, proper communication with other professionals, which will really get them to open their eyes to chiropractic as a whole. And while they really do know what they're doing, they're handling these cases very well. I'm looking forward to working with them in the future. That's really how it happens.
Okay. To that, any advice that you'd have for aspiring physical therapists, chiropractors, physios that aren't even in school yet, or graduate school, that being said, any advice for them?
Yeah, just don't lose that thirst for knowledge. Like I said, this is all everything kind of comes back to like you've got to be hungry for further education, further knowledge, and a lot of that is self-study. It's not going to happen overnight. No professor's going to wave a wand around your head one day and say, "Here, you know everything there is to know about chiropractic or physical therapy or about this condition." They can't do it. It can't exist, and everything changes every single year, right? So you just have to constantly be hungry and look things up and take seminars and find a research article. So just really be hungry for pursuing further education, and just never stop learning. I think that's something they need to know. And again, it comes back to communication. Get good at talking to people. Go out, talk to somebody you haven't talked to at church, at the bar, at your gym. Like strike up a conversation. We've lost that. We're all on our phones, and we're very good at communicating digitally. We're not great face to face anymore for some of the younger populations. So get comfortable talking to random people, and you'll see how much more your patients communicate with you and how much more you pick up from them, even nonverbal stuff. Again, you'll pick up when I'm face to face with you. I can see the way your eyebrows are raising, your head tilting, you're nodding, versus over a message, text message, email. I don't know what your body language is. So talk to people in person, and never lose that hunger for knowledge, and just never be afraid to look anything up either.
Do you find it important for a student to have a specialty or a niche that they want to go down, or is that not a concern for you or something that you would advise a student?
Yeah, it's not something I really advise. I work with them so young on that we're we're years away from, hey, you need to learn everything there is to know about baseball players when you don't know there everything to know about just back pain in general yet, right? So I would say just in the role I'm in, I would say it's not of my utmost importance because I have to make you a good chiropractor regardless, because you don't know day one what's going to walk into your office. Like I only want to work with 20-year-old baseball players. Okay, well, what happens with that 10-year-old little girl walks into your office? You're like, that's not what I was like planning on. What are you going to do? Turn them away? I'm a big fan of family practice, general practice. Simply, I think it makes you a better clinician because now you see more things. I see infants have issues that people in their 80s, 90s can't have, and everything in between. So I don't personally think it's a major issue. And I don't think it should be something people strive for early. Now, with that, that doesn't mean after you've gotten to practice and you want to market yourself and you want to excel in a certain type of patient population, well, then sure, because then it does set you apart from other people. If that is what you're going to do, I want to work with baseball players, then you better be figuring out everything there is that needs to know about how to properly evaluate, assess, and treat baseball players, and do that, get good results, and grow that, and that could help grow your brand. So that gets more into marketing than anything. It's not a clinical thing. I'm not saying like it's a good clinical decision to find a niche. It's a very good marketing and branding thing to find your niche and say, hey, this is the people I'm really good at treating. And then you build that brand, and then you'll grow your practice and grow your wealth. So yes, there is an avenue for that. Early on, I don't think it's as important because you're just learning so much. I don't want you to close the doors to all those other populations just yet.
Yeah. What are your personal plans as a doc that's still growing into your role, and what are your goals in teaching young and upcoming clinicians?
Yeah, my goals are kind of the same as they've always been. I want to continue to grow myself, my knowledge base, and relay that to students. I want to try to learn um, the new challenges of populations as they come through. I'm getting exposure to younger students as I get older, right? You deal with different social challenges and stuff. So to continue to learn how to best communicate with my students. And ultimately, I mean, it's just to produce the best chiropractic clinicians possible. That's my goal in the ever-changing time that every year that's different. I'm releasing them to a new world every single year. The landscape has changed. Populations have changed. I mean, we're about to see a huge geriatric population boom like we've never seen before. And I don't think medicine is prepared for that yet. So trying to foresee that and prepare students for that, that's upcoming in medicine. But overall, it's really just be better myself every single day, relay my skills, knowledge set, and passion towards my students so that they take that on and learn with it and grow from it. And at the end of the day, that's how the profession grows too. You get them out there as young, passionate, knowledgeable docs that really care about doing right by their patient. And that gets seen by patients, other providers, and that's how the profession grows as a whole. And really, we all succeed.
Yeah. Yeah. Just, piggybacking off of that, just my own personal experience working with you on the day-to-day, just your openness and willingness to teach people, but also challenge us and push us, the endless handouts and information that you're willing to put forth to the students, but that fine balance between really pushing, but also allowing the student to learn and make mistakes safely, but learn and grow, because that's where all the learning and growing happens is, whether it's making decision, realizing that the decision wasn't necessarily the right one, but to learn from it and reassess and see where they went wrong and keep moving forward, pushing the needle in a positive direction. And I found it to be such a pivotal thing for me moving in as a, first trimester clinician, which is, a really big deal and something that when I get older and I'm in practice for years, I can do the same for up and coming clinicians. So that meant a lot. And I know it meant a lot to a lot of the students at the clinic in New York. Any other, last comments or things that you wanted to say or put out there before we wrap the show up?
I think you just did a great job summarizing that, and all of that. What you're explaining is evidence-based learning. In my class that you had with me, everyone rolls their eyes and we go, oh, evidence-based, I gotta read a research paper. And it's like, that's not what that is. It's kind of like the scientific process. We learned that when we were in schools. It's, we have a question, we're searching for answers. We, come up with a plan to find those answers. We execute it, and then we get results and we evaluate those results, good, bad, or indifferent. And that's exactly what you're doing in clinic. We're doing it under the umbrella of experienced clinicians, but I still got to allow you to make those mistakes. And that reflection part, that last part of after I get my results of evaluating them, is the reflection. That's what solidifies. I go, oh crap, I didn't do that right. I should have sent them for this test, or I should have done this orthopedic test, or I shouldn't have done that treatment. That's how you learn. You learn from good and bad mistakes. Or, you know what? This really worked on this patient. I can't wait to do it again on my next patient with this condition. that's learning. That's the scientific process. So we can't be afraid to fail. We have things in place as safeguards so that we don't hopefully make a big fail that's, fatal to somebody, especially in our profession as chiropractic. We're a little protected there, but there are times we could miss things if you don't have those checkpoints. So, make sure you have those instilled in your practice where it's, we're 6, 8, 10 visits in and my patient's not better yet. I've got to reevaluate that and see why. Am I missing something? Am I doing something wrong? Do they just need more time? So always have those check boxes throughout their patient care so that we don't miss something. If someone's gone 15 treatments and they're not any better, well, something's going on. You've missed a boat somewhere, whether it's your treatment, your diagnosis, or whatever. So make sure we have those set up, and that's any professional, to catch those mistakes, before they turn into something big. And again, just don't be afraid to make them because that's how you learn. You can't learn if you did everything perfectly, you never learn anything, right? And that's just not reality. You're going to make mistakes, you're going to have pitfalls, and all of that is learning. So really take a moment to reflect on it. I do think that's very important to learn and continue to grow as a provider and a young professional.
Awesome, man. I love it. Is there any place if someone were to be seeking pain management in more of a private sector, anywhere they can reach out to you, ask questions, and work with you privately?
Yeah, I definitely still do like consultation style stuff. I love talking with young providers, colleagues, or patients if they have questions. I tend to stick it towards the students and colleagues because then that way the recommendations to patients will go through them versus if I'm making a recommendation or referral to a patient that I don't have that relationship with, it opens up a little muddy waters. But I'm definitely always up for working with colleagues or students that are, having difficult cases or know somebody and see if we can collaborate, kind of think tank that and get the patient where they need to go or whatever care it is that they might need. So I'm always willing to do that. Probably not as much patient direct, just because of scope of practice, licensing things. That's all. And you kind of have to have that intermediate. But for anyone that would like to contact me, um, email is the easiest way. Just if I need cell phone number, we can give that out too. But my personal email, which is twhiting44, so it's TWHITING 44 at gmail.com. Easiest way. I'm on it all the time. Shoot me a message. If it turns into more than that, we can pick up the phone, have a phone call, have a Zoom, and talk about stuff. I am hopeful to get kind of my own podcast type thing up and running. I'm looking to do, me and another former student of mine are looking to kind of do like grand round sessions. I think I had talked to you guys about this
Yeah.
before I left there. We're like once a month in the evenings. We meet nonchalantly and talk cases. What cases do you have? What are you struggling with? Or what did you have really cool results with? So we can learn. Maybe you're fantastic at treating rotator cuff problems, and that's where I struggle. When I have the chance to sit there and go, well, what are you doing that I'm not? And immediately take it to the clinic on Monday morning. So I'm looking for that to start up, maybe in a month or two. I'm just kind of getting settled in here, but it'll be a once a month thing. We talk chiropractic, whether it's cases, whether it's research, whether it's getting into practice. And this is for anybody. This is for students. This is for practicing docs, clinicians. This is for other professionals if they're just curious about what chiropractors see and want to sit in on it. We got nothing to hide. We're going to keep patient privacy. No one's going to know who these patients are by name. It's not like that. I got this case, this patient. What can we do? So I'm looking to get that started up, probably via a Zoom, just because again, I like the face-to-face type of thing.
Sure.
So
Is that something that will be public
yep.
afterwards? Awesome.
Yeah. It'll start smaller with like students, former students. So I will definitely get you that information that you can share with fellow classmates and students and stuff and colleagues when it gets up and running first. And then eventually I'm looking for it to have like a regular website landing page that if you just go to and you hop onto the Zoom link that night we're having it, you can pop in and just see what we're about. So
Awesome.
yeah.
Man. Yet another resource. Awesome. Well, listen, man, we really appreciate you coming on. Tons of experience and insights that you had, and I'm glad that we were able to share it through this vehicle. So thanks again, man. I appreciate it.
Yeah, thank you guys so much for having me. It was a great time. Please, if anyone has any other questions I can help them with, you know where to get a hold of me, guys.
Awesome.
Thank you.
Listen, everyone, thank you for joining us for another episode of the Primal Performance Podcast. We look forward to seeing you next time. Take care, guys.